Imagine having a disease that quietly enters your body, spreads without warning, often shows no symptoms, and yet has the power to destroy your reproductive health, damage vital organs, and even affect newborn babies. This disease does not discriminate. It affects men and women, young and old, rich and poor, educated and uneducated. And the most dangerous part? Many people who have it don't even know they are infected. Today's video is about gonorrhea, one of the most common yet most underestimated sexually transmitted infections in the world. According to global health organizations, millions of new cases of gonorrhea are reported every year, and the numbers continue to rise. Even more concerning is the emergence of antibiotic-resistant gonorrhea, which is becoming harder and harder to treat. In this video, we will uncover what gonorrhea really is, how it spreads, the signs and symptoms many people miss, the dangerous long-term effects, available treatments, and most importantly, how you can protect yourself and others. This is not a video meant to scare you. This is a video meant to educate, empower, and protect. So stay with us until the end, because this information could save your health, your fertility, or even a life. What is gonorrhea? Gonorrhea is a sexually transmitted bacterial infection caused by a bacterium called Neisseria gonorrhoeae. This bacterium thrives in warm, moist areas of the body, such as the reproductive organs, the urethra, the urine passage, the cervix, the rectum, the throat, and in rare cases, the eyes. Gonorrhea has been known to humans for thousands of years, yet it remains one of the most persistent and widespread sexually transmitted infections today. Why? Because it spreads easily, because it often shows no symptoms, and because many people feel embarrassed or afraid to seek medical help. Gonorrhea is not a virus. It is a bacterial infection, which means it can be cured, but only if treated correctly and early. If left untreated, gonorrhea does not simply go away. Instead, it silently spreads, damages tissues, causes inflammation, and leads to severe complications. This is why gonorrhea is often called a silent destroyer. How does gonorrhea spread? Gonorrhea spreads primarily through sexual contact. This includes vaginal sex, anal sex, oral sex. It can spread from one infected person to another even if ejaculation does not occur. This is important to understand. You do not need to see symptoms to transmit gonorrhea. The bacteria are present in bodily fluids, such as semen, vaginal fluids, and pre-ejaculatory fluid. Gonorrhea can also spread from an infected mother to her baby during childbirth, through contact with infected eyes, leading to eye infections in newborns. What gonorrhea does not spread through: hugging, kissing, sharing food or drinks, toilet seats, swimming pools. Another critical fact: a person who has had gonorrhea can get it again if exposed. There is no lifelong immunity. This makes prevention and education extremely important. Symptoms of gonorrhea. One of the most dangerous aspects of gonorrhea is that many people experience no symptoms at all. However, when symptoms do appear, they may differ between men and women. Symptoms in men: burning or pain during urination, white, yellow, or green discharge from the penis, swelling or pain in the testicles, frequent urge to urinate. Symptoms in women: increased vaginal discharge, pain or burning during urination, vaginal bleeding between periods, pelvic or lower abdominal pain, pain during sexual intercourse, throat gonorrhea, sore throat, difficulty swallowing, mild redness, often mistaken for a common throat infection, rectal gonorrhea, rectal pain or itching, discharge, bleeding, pain during bowel movements. Because symptoms can be mild or completely absent, many people unknowingly pass the infection to others. This is why gonorrhea continues to spread rapidly worldwide. Dangerous effects of untreated gonorrhea. If gonorrhea is not treated properly, the consequences can be severe and life-changing. In women, pelvic inflammation disease, chronic pelvic pain, infertility, increased risk of ectopic pregnancy, damage to reproductive organs. In men, epididymitis, painful inflammation near the testicles, reduced fertility, chronic pain. In both men and women, increased risk of HIV infection, bloodstream infections, joint infections, heart complications, rare but serious. In newborn babies, severe eye infections, permanent blindness, life-threatening complications. Perhaps the most alarming issue today is antibiotic-resistant gonorrhea. Some strains no longer respond to common antibiotics, making treatment more complex and dangerous. This is why early detection and proper treatment are critical. Treatment and medical care. The good news is, gonorrhea can be cured, but it must be treated correctly. Doctors usually prescribe a specific antibiotic injection, sometimes combined with oral antibiotics. Important rules. Always complete the full course of treatment. Do not self-medicate. Do not stop treatment early. Avoid sexual activity until treatment is complete. Inform recent sexual partners so they can be tested. After treatment, follow-up testing may be recommended to ensure the infection is completely gone. Failure to treat gonorrhea properly can lead to drug resistance, making future infections much harder to cure. Prevention. How to protect yourself. Prevention is always better than cure. Here are proven ways to protect yourself. Use condoms correctly and consistently. Get regular sexual health checkups. Limit the number of sexual partners. Communicate openly with partners about sexual health. Get tested if you have symptoms or a new partner. Seek medical advice immediately if you suspect exposure. Education is one of the strongest weapons against gonorrhea. The more people know, the fewer people suffer in silence. Final message. Gonorrhea is not just a disease. It is a public health issue, a relationship issue, and a personal responsibility. There is no shame in learning. There is no weakness in getting tested. There is only strength in protecting your health. If this video helped you, consider sharing it with someone who might need this information, subscribing for more educational content, and starting open conversations about sexual health, because awareness saves lives. Stay informed, stay safe, and remember, your health matters.